Welcome to my video diary about getting my nose done, rhinoplasty, turbinate reduction. This is not a medical video at all. I have zero medical qualifications. This is just a video diary of my experiences because I find it super interesting and a fascinating thing, and I watched so many videos about people getting their noses done before I did mine, so I just wanted to share the experience. And this is also not to convince you to get a nose job. Please do not interpret it that way. This is just me going through the process, and yeah. So I hope you find it interesting. Very different than anything else you'll see on my channel, but yeah, enjoy. Okay, so my left side of my nose, I really like a lot. I've always been very happy with it. I enjoy this profile, but when I was, I guess like 11 or 12, like around that age, I broke my nose. And so from this side, it's straight and it, you know, suits my face. From this side you can see that there's a break, and this is something that started to happen when I was going through puberty. So I didn't always have, like, my nose hasn't always looked, the break hasn't always been this exaggerated. It's shifted a lot in the last few years. When I was a teenager, it wasn't too serious. I could tell that the shift was happening and I was starting to feel some of the symptoms of that, but it wasn't so pronounced. Like, you might look at me and not even notice it. Whereas in the last few years, for whatever reason, I guess because, you know, as you get older, your face actually changes a lot and your face is always growing. It started to not really feel like me. And especially when I was in my mid-20s, that's when I really started to notice it. So yeah, this side is like, my profile is completely different from either side, and I notice people noticing it, which kind of weirds me out. And I have a habit of kind of like doing this, like I kind of like, you know, it's like I'm unconsciously like thinking about it, and I don't breathe from the left side, which really bothers me. I'm a mouth breather, and it feels uncomfortable. Like, you know, imagine a broken bone healing wrong. It feels very uncomfortable, and it's the focal point of my face, so that kind of bothers me. And I get like if you can imagine a headache like in the center of your face, because I get really congested, like especially on this side where there's no airflow, and then this side gets like really bloody, and it just, you know, it bothers me, and I've just wanted to fix it for a very long time. So I think in the last few years it's become exasperated. And so I've gone to a few different ENTs over the years, and before I would get the response like, oh yeah, I can see it's shifted, you know, it's definitely moving. But this past summer I went to an ENT and I asked him about it, and he was like, yeah, clearly. He's like, it's clearly shifted quite a lot. And I was like, okay, now he's telling me like, this is obvious, like, how, you know, why are you even asking me? But just hearing someone say it to me, like, now it's become so obvious, you've let it go so long, I was like, man, I just want to get it over with. Like, I've spent so many years researching and speaking to different ENTs and different surgeons. Like, now I just want to get it done. Like, I'm 30 years old. I've had a broken nose now for like most of my life, and it's just time to do something about it. It's bothering me so much. So I kind of got to my breaking point. I'm heading out for my consult appointment with the doctor who I think is going to be the right one for me. I went to a plastic surgeon. I researched plastic surgeons for a number of years, went to different consultations, and then eventually found one that I was really comfortable with and trusted. I went for this other consultation. I took my mom with me, and this plastic surgeon is quite well known in Toronto. I've seen a lot of different reviews for him online and stuff, and I would say it went okay. It was a good getting my feet wet kind of experience. He didn't specialize only in rhinoplasty. I did carry his business card in my wallet for about 3 years after that, because I was like, I want to go, I don't want to go, I want to go, I don't want to go. I didn't feel like my parents really understood why I wanted to do this. Like, my family was kind of like, what? Like, why do you want to get your nose done? And I was like, also afraid of surgery, and I don't know. By that point, I think I was about 26. I opened up to my husband about the fact that I really wanted to do this and that I was really, really afraid of it. And he was like, first of all, don't let fear guide your decision. Second of all, he was very supportive and he said, I know your nose is broken. If you want to do this, like, that's your decision to make. He didn't have an opinion either way. Whatever decision I made, he was happy to support. So that felt really good. And then I started watching YouTube videos of people who've actually experienced it themselves, because now with vlogging, like, people show you their entire procedure. It's actually really common. It's easy to find these videos. So then a few years passed. I had done, a lot more reading, a lot more watching of videos, a lot more research that way. And then I decided to book another consultation. I thought, after I came out there, I was like, I don't want him to touch my face. It really freaked me out. And then I came across the surgeon who I ended up booking with, and fabulous reviews all around. The only negative thing that people had to say was that the wait time in their office was long, which to me doesn't matter at all. But all of the reviews were about the artistry of it, the care, the skill, the detail of the work, how natural it looks. And that was what sold me on this particular surgeon. I just made my appointment. That's so crazy. Broken nose will be no more. Yesterday I made my payment, which means that my appointment is booked. I'm somehow both a bit excited, a bit nervous, and also very calm about it. I've got to that point, I think, where it's like I just want to get it over with. So what he's going to do is try to straighten it as much as possible. Not going to be 100%, but any improvement is good with me. And then this side is not really droopy, whereas this side is, so he's going to like even it out. Basically the whole goal is to achieve as much symmetry as possible, and because I like this side, I would want both sides to look like that, so he's just going to try and make it as even as he can. I don't know exactly what it's going to look like. He said it was kind of an odd case because I don't have a specific look in mind for my finished nose, aside from the fact that I like this side of my nose, and that's really all I could tell him. Something that I just keep going back to over and over throughout the years is like, but what would my nose have looked like if I didn't break it? Like, imagine my glasses not sitting crooked, or imagine me looking the same from both sides, like, because sometimes I catch myself in the mirror and from this side and I'm like, oh yeah, right. I notice people not recognizing me from one side or the other. It's just like really weird. And I guess I've come to realize it's kind of like a disassociative feeling where I'm like, this isn't how, like, it's been altered, So I always go back to like, well, what if I hadn't broken it? What if I hadn't broken it? Okay, how did I break it? I got a basketball thrown directly at my face and it crushed my nose and really freaking hurt. And then a few years later, when I was, I think, 18 or 19, I was living in residence. I got my nose broken again. It was the Olympics, the Vancouver Olympics, and I live in Toronto. And this very tall man was cheering, and like his elbow ended up coming down into my face. I mean, I didn't even know the person. You would see all these people cheering, and then you'd see me being like, okay, I just had my test done, and it's funny because the way they do the test, they stick this Q-tip up to the back of your nose, and she's like, I just want to let you know it's going to feel like you're submerged in a pool of water, or your eyes might run, or it's going to feel kind of weird. And I was like, oh, don't worry. I recently had a camera put all the way back through my nose to the point that it actually touched the back of my tongue, so I think I'm okay. I feel very good knowing that it's done, and now I can just like take all the protocols to be as safe as possible. Just gonna take a little pregnancy test. Seems like a good idea. Okay, we're good. My surgery is 2 days away, so it's the final haul. I feel like Friday was a weird feeling, like the realization that my face is gonna look kind of different, and I was like, oh, this is so weird. And then Saturday, I was like, you know that feeling like right before you wash your hair, when you're like, oh, my hair is not that dirty, like my hair looks great, and then you're like, no, I need to wash my hair. That was me on Saturday. I was like, my nose isn't broken, like, it's fine. And then Sunday I looked at pictures and I was like, No, it's definitely broken. Yeah, I've been wanting to do this for a reason. And then today, Monday, I'm like, okay, now I wish it's just over with and like get to recovery period. Prior to getting my test done, I went out and got all of the odds and ends that I would need for my recovery. So I realized that pretty much not every, but like most of the things that I own are like turtlenecks or like things with like tight necklines, which is not great when you've just had a rhinoplasty. So I went out and got a few like wide neckline nightgowns, because I think nightgowns are just going to be really comfortable and easy. And then I've also started to prepare my meal planning because I do have food allergies, so I don't want to take like extra chances on things when I'm already in a vulnerable position. And that way I'm like reducing the chance that I'm going to eat something suspect that could cause me to have an allergic reaction. So, I mean, I am bringing like 4 EpiPens with me just in case. But ideally, I will have to use 0 of them. It's officially 25 hours until I'm supposed to be at the surgical center. It's just like so wild. I'm rereading all of my pre-surgery instructions, my aftercare instructions. I feel like I don't know what to do with myself today. And then I have to pick up my prescriptions at some point. So that's really it. Like I'm not used to having such an empty day. So I don't know what to do with myself. I'm also just checking the calendar like, okay, it's tomorrow. Not today, it's tomorrow. Like going over it repeatedly to make sure that like I have the right day. It's almost easier like the weeks before, because I thought I would have more stress like the weeks going into it, but no, it's like the day before that I'm like, now I have to make sure I do everything properly. Well, this is really freaking stressful, but I just called my pharmacy and I was like, hi, is my prescription ready? Because it was supposed to be ready yesterday and it's not, and like I really need to come pick it up now. And they've had it for over 2 weeks, and we've like spoken in detail about it, and like I thought this was ready to go, and the pharmacist was like, oh, I haven't had a chance to do it yet, the schedule's been really weird. And I'm like, I have to come pick it up, I have to take the things tonight, I have the surgery tomorrow morning. Like, and then she was like, oh, well, I'll have to make sure everything came in. And I'm like, I don't even know what would happen if it wasn't done in time. I don't know. Like, do I just hope that she can get in the regular non-compounded version? Like, hope I don't go into anaphylaxis? Like, I don't know. Or do I have to like move like, I don't even think they can move the appointment. Like, if this is a big, it's not a pizza delivery service, like it's a surgical center. Okay, this is like really throwing me off, and I don't know, I'm just like, that like I was feeling so confident and so good, and like that like really threw me off. Well, there's always a plot twist. So this process of picking up my meds, which I thought was going to take no more than half an hour, ended up taking like over 2 hours. And now it's like 7 o'clock and I'm gonna rush home and eat something and shower and like try to relax, like freaking relax, like if possible, and take my first dose of my medication or whatever. And just like, now I need to like shed the stress of today. It's like a very weird day. But anyways, we made it work. I got everything I needed. Going through this process, it has become very clear to me that for many years I let my anxiety about getting a rhinoplasty and like my fear of it guide my decision, which is one thing if you like are torn between whether you want to do it or not and you decide not to do it, like that's your choice. But for me, it was like I wanted to do it, and I also knew that my nose was shifting a lot, and I think when I was like 25 would have been the ideal time to do it. But anyways, I think I had this like deep-seated fear in the back of my head, and it was really holding me back from making logical decisions. And even though I started to do more research and started to understand like actually a lot of people do get these kind of procedures done, and it's kind of like something that happens very often. It's not that I'm like looking at this anomalous procedure that's like way out there. Like obviously surgery does have risks associated with it, of course, but in terms of like, in my head, I think I was thinking of it as like it's such an unusual thing to do, but it's not really. And So becoming more familiar with it kind of, and like also reading more about it and researching more and fully understanding the information and the logic behind it helped make sense to me and kind of helped me get over my anxiety a bit. I mean, as my dad said at one point, I was telling him like, but what if people think that I'm vain? And he's like, it's kind of vain for you to think that people are thinking about like you that often. I was like, he has a point. Like, it's not that anyone's sitting at home like thinking about how vain I am. I don't know. I just like had this weird idea in my head, and I told him like the only reason I haven't done it yet is because I'm afraid, and he was like, people get nose jobs every day, so if fear is the reason that you're not doing it, then like that's not a good reason. You know, like fear shouldn't be the thing that holds you back from things. Like cost is a reason, timing is a reason, uncertainty is a reason, not finding the right surgeon is a reason. Like those are all valid reasons. And then all of these worries that I had about like, oh, are people gonna think that I'm vain for doing this? It just sounds kind of stupid now, to be honest. When I go into something with a good attitude, the result is usually a better outcome because I'm setting myself up for success. I think that when I've gone into things with a negative attitude, it's like a parasite, you know? Like negativity kind of just weaves its way into things. And so I'm trying to go in there with positivity and a good outlook on how it's going to go and just preparedness, because stress and anxiety don't actually help me prepare for anything. They just cause panic and confusion. Is it weird that I love the taste of liquid medicine sometimes? This one's bubble gum. Or cherry? Maybe cherry. It's hard to tell. Because I went to a private clinic, my surgery was done at a private surgical center, not the hospital. If you go the OHIP ENT route, it's probably done in a hospital. So there I am in the waiting room. And there I am after. I actually felt really comfortable throughout the whole thing when I got to the surgical center and everything because the staff was amazing and it was a very seamless process. And the I can never say this word, but they gave me the anesthetic was very careful and listened to my concerns about my allergies. And then I was asleep and then I was having surgery. When I woke up, I remember being in such a haze. I don't know if I dressed myself or not. But anyways, here I am. This is a video that I recorded the first night after surgery, and I was really high and whispering, and I don't remember what I was saying. But I think I was trying to demonstrate how I clean my nose, which you have to do pretty often to maintain cleanliness and to prevent infection. So that first night was really rough. I got up pretty much every hour, and I was drinking water like crazy. I could not quench my thirst. And I think it was just a combination of all the drugs and the anesthetic. However, it wasn't great for the night after surgery to be getting up so often, so my temperature did rise. I had to keep really careful track of that throughout to make sure that I didn't get any kind of infection. So here I am telling you about mustache bandage, which is basically the bandage that catches all of the blood and pus and stuff that comes out of your nose and is really gross, and you change this bandage pretty often. One thing I was unprepared for was the feeling in my eyes, which was normal, and that it was due to an antibacterial coating that they put on my face and eyes during the surgery. And it just took a few days for my eyes to tear it out, but it felt super weird for the first few days because my vision was really skewed and I couldn't focus on anything. So once that was gone, I felt so much better. Basically, my face was entirely numb. Mostly my nose was entirely numb. So I didn't feel any pain at all. And I felt like I just couldn't really move my face. There was also a lot of pain actually behind my teeth where the breathing tube hooks in. So that just took a few days to go away, and then that felt normal again. But it was just uncomfortable. It was hard to drink anything. But one of the greatest ever was right after surgery. Even though I was in such a haze, I remember the surgeon telling me to take a breath through my nose, and I could. And I haven't breathed through my nose like that since I was a little kid, and that was the most incredible feeling. I didn't have much of an appetite that week, so I stuck to mostly liquids and soft things. I did have a reaction to one of my prescriptions. Unfortunately, after several days of taking it, it was really unexpected. And of course, it coincided with the day when my swelling was at its worst. So that was a very confusing feeling as someone with anaphylactic allergies to see my face swelling up so much and also see my body reacting to a medication. It was a horrible night. I will never speak about it again for the rest of my life.
It wasn't anaphylactic, but they told me to stop taking the pills anyways, just to be safe. So I healed from the surgery naturally. I didn't take any painkillers or any anti-inflammatories. So then I got my cast off and it looked super weird. During the whole recovery period for the first few weeks, I felt a lot of mental fog and I just felt really, really tired all the time. And I felt like I had a hard time concentrating on things. I couldn't really look at the computer. I couldn't even really enjoy a movie, to be honest. I was just really distracted. I couldn't even smile. Like, look at me trying to smile. I was just kind of beat up.
And all the oozing has stopped, so that's great. I can sleep a lot easier now. I ordered all these snacks online to go to my home. I'm not at my home, so my snacks are not here. And I'm like incapable of blowing my nose, and I can't feel like any of it. And I can't feel like here or here or here. It's just like, I mean, I can feel it if I touch it, but it's like numb. So it's like when you get your mouth frozen to get a cavity filled. It's that feeling, except it's just like here.
My first outing was so exciting. I walked around for all of 5 minutes. Then I felt my nose swelling up, and then I was done.
It's about like 4 weeks after the surgery, and I would say that mentally I'm in the mood where like I want to resume work and I want to get back to my normal life, and I'm feeling a lot more mental clarity, which for the first 3 weeks, honestly, I was like just kind of exhausted all the time. My face just feels so much more balanced, and I don't feel uncomfortable at the idea of like talking to someone who's sitting on my right side, which is amazing. I knew my nose was uncomfortable for so many years and progressively getting even more uncomfortable as I got older, but I didn't know how uncomfortable I was until I got it fixed. And I was like, wow, I feel so much better now. Like this is crazy. It's unbelievable how much better I feel. And so that tells me that, I did the right thing listening to my gut and finally going for the surgery. So I feel really good about my decision, and I'm so happy with the surgeon that I went to, and I just think he really knew what he was doing and the right look to achieve for my face. And it's odd because my mom says that now I look more like how I used to look before I broke my nose. And so we were looking back at a whole bunch of old pictures, and it's true, I do actually look how I used to look. So that's super strange. I do want to take a moment to talk about self-confidence and body image and self-perception, because I have a lot of young people in my life, and there could be a lot of people watching this video who might be impressionable or seeing plastic surgery everywhere and feeling like there's some kind of pressure to do it or to make yourself look a certain way. And that's not what I intend to do with this at all. For me, I always felt like I live my life how I want to live it, and my self-confidence is not hinged on me looking a certain way or me getting a surgery done. Because realistically, if I hadn't had this surgery done, I would still be living my same life and doing the things that I wanted to do. For me, it was really about like, I want to feel most fully like myself, and I want to relieve myself of discomfort, and I want to look in the mirror and feel like I see who I see in my head. I want to see that in the mirror. I was bullied for my nose when I was younger, especially in high school and university, and some people were really mean. I had so many people said really shitty things to me about my nose, like especially in high school, people would ask me like, why do you look like a witch? Or like, why is your nose so big and so long and has a lump in the middle? Like, your nose doesn't suit your face. And in university, I remember this one guy made fun of my nose to the point that I actually cried. One guy in high school told me that I looked ugly from the right side and he didn't want to sit on that side of me. So basically, people can say a lot of shit. But at the end of the day, the people who are saying shit like that to you are the ones with the problem, because you don't say things like that to people unless you have some kind of self-confidence issue yourself. Like, maybe I was the recipient of a lot of these comments, but I never said nonsense, like rude, idiotic crap like that to other people. Like, I've never made fun of a person's nose or their hair to make myself feel better, So at the end of the day, I always just remind myself, like, yeah, this hurts, it's not enjoyable, it's not the best thing, but they obviously have problems. Like, that's that person's problem. So it doesn't really matter. This is just a personal decision, and if you're doing it, you should only be doing it for you. With any plastic surgery at all, it should be taken seriously because it is a surgical procedure, and as you have seen in this video, it's difficult. Like, it's not a nice recovery. I know people in the media just talk about nose job or boob job or like all these different surgeries as though like, oh, she just got this done, he got that done, whatever. It's not the case. These things are hard on your body. They're difficult. They're not enjoyable. They're expensive. They're time consuming. So it's not just to be treated like any old thing. So basically what I want to communicate is just, this is only something that if you want to do it, just do it for you. That it shouldn't be someone else's decision. And if people are saying things to you that you need to change a certain part of yourself, and I'm not just talking about your nose, I'm talking about, I don't know, any physical attribute of you, it is only up to you to decide that. Like, and also, people will give you feedback on anything. That doesn't mean that their feedback is valuable. So really take everything people say about your physicality with a grain of salt, because the only person whose opinion matters is yours. After I got my cast off, I was asking him, like, so how did the surgery go in your opinion? Like, do you feel like it went well? Is there anything that I should know? And he was like, well, we did a lot of work. And I was like, oh God, okay. And then he said that my nose was really twisted inside because I guess, like, because it was broken and it had been so many years, I guess it had, like, healed in a really strange way, which explains also the physical discomfort I was feeling. So he said they actually had to put an implant in. Something that felt so good was the reception of my friends, like my friends and family hearing about the surgery. And when I told them that I was going to do it, first of all, my BFF was like, okay, it's about time. Like, you've been looking into this for so many years. I'm so glad that you just like pulled the band-aid. You're going to feel so much better. And I was like, yes, thank you for supporting me. And my parents were supportive but nervous. And like my other friends, I dropped a message in a group chat that I have with a bunch of girls, and they were all like cheerleading me on, and they were like, we know you wanted to do this, so it's gonna be so great, and don't worry, it's gonna be fine. So no one gave me any like bad feedback. I mean, a couple people were like, oh, why are you doing it? Like, you're pretty. And I was like, it's not about pretty, it's just about feeling like me. And it's hard to explain, but also you don't really owe anyone an explanation. Alright, well, it's been 3 months, so that's pretty hard to believe. I had my 3-month check-in today at the plastic surgeon's office, and they took my 3-month pictures, which is just unbelievable. How did 3 months go by so quickly? I decided I'm not gonna do like profile underneath, like all of those shots in this video. They do exist, I'm sure, on the surgeon's website because I gave my consent for that, but again, like, I'm not trying to convince you to get a nose job in this video, so I really don't want to show that kind of like before and after type of look. So my 3-month check-in went really well, and everything is healing on track. It's still, I'm going to come a little bit closer so you can see there's still some swelling. Especially, I noticed that the left side is a bit more swollen than the right side, so just like around the middle of the nose area. So he said that's normal, and I'm still numb underneath. Like, basically they do an incision here and then they kind of like lift your nose up. It's really gross. But yeah, so this underneath incision area, I'm still pretty numb, but I can do this with my lips now, which I couldn't do for the first like 3 months. And yeah, my nose is really like clear inside. I can breathe from both sides, and my particular rhinoplasty was a bit of a toss-up as to how it was going to go, because he told me up front that it was a 60-40 chance that the deviated septum part of the surgery would be successful. So I already knew that the odds were against me. And then it was also a 50-50 as to whether my nose would maintain a straightness or whether it would heal crooked as it was before. And so he said I kind of lucked out on both counts, though I will also say I'm sure that the skill of the surgeon's hand has a lot to do with it, and I did go to the best plastic surgeon for rhinoplasty in Canada. One of the greatest feelings after getting this done was putting my glasses on, and as you can see, okay, my glasses are a little bit dirty. Hold on, let me clean them. But my glasses are so much straighter than they were before, and it's just such a great feeling. Like, I used to look in the mirror and see my glasses being like on an angle, and it reinforced like, oh yes, your nose is broken. Now my glasses sit straight and it's just comfortable, and it just like, it's just better. I don't know. So my face is still, of course, a little bit asymmetrical because I've had a broken nose for so many years, and that does affect all kinds of things. It's just so great to have, I don't know, it's comfort. It all comes back down to comfort. And so when I first put glasses on after the surgery, I was so excited, I almost cried. Like, I put my reading glasses on, my blue light glasses, I put every pair of sunglasses on that I owned, and I was just thrilled because it was such a unique and like novel feeling for me to see my glasses actually sitting straight on my face. So that was super cool. And today at my 3-month check-in, he did offer to do a couple fillers. So I have read about this, that first of all, there is also non-surgical nose jobs, which is where they kind of like add filler to your nose in certain places, which is kind of a different thing. But what he was offering me today were some fillers to just kind of even out and increase the symmetry of the nose, because my nose is still like very slightly crooked, and I guess using fillers maybe he can make it look less so. But I actually refused it because I still want my nose to have some of its original character. I have to do some research on the particular fillers that he uses, because I know that some fillers are derived from dairy. I don't think the one that he uses is, but I just want to, of course, give myself some time to check. I might change my mind and go back, you know, it's up to me to decide. You might also be wondering, why did I choose to do this in 2020? Doesn't it seem like a bad time or a high risk time? And honestly, I think, as I said earlier in the video, I had been wanting to do this since my very early 20s. Like, even in my teens I had been thinking about it, and I had been putting it off for so long. And I think that 2020 just taught me that if there's something I want to do, I should really just do it, because you don't know what's going to happen in life. And it's also a situation where we don't know how long all these like lockdowns and things could be happening for. It could be happening for the next 5 or 10 years. Like, we have no idea. So it becomes a question of then, what is the right time? I don't think there's ever a perfect time. And in my case, I was in a comfortable situation to do so. I had people who could help take care of me. My in-laws took care of me for the first week, and then my parents took care of me for the 2 weeks after that, because my husband did have to go to work every day. So timing is really difficult to determine. It was, in a way, I guess, good that there was no reason for me to have to leave the house. Like, it made recovery easier. It certainly made it a bit more, I don't want to say dangerous, maybe I was more susceptible to getting ill afterwards because your immune system is lower after you have surgery, but I was extremely careful, and that was a top priority for me. I'm definitely like a safety ranger, so that was super, super important to me. And it's also a time of life thing. Like, I do want to have kids, and I kind of wanted to get this out of the way beforehand. And after having gone through the surgery, I think that doing that recovery with children would have been extremely difficult. So I'm really happy that I did it when I did it, and just got it over with, and now it's behind me. So actually, my initial plan was that I was going to see my ENT in the early spring of 2020, and then if he gave me the go-ahead and everything, I was going to go book my appointment with the plastic surgeon after. And then, because 2020 just threw us all for a loop, that appointment got delayed, and then delayed again, and then by the time I saw my ENT, it was late in the summer, and then he was like, yeah, your nose is clearly broken, like, why are you even asking me this? And then I went and made my appointment with the plastic surgeon, and then they booked me for actually March of this year, of 2021, but then I got in on a cancellation. So that's just how the timing worked out. I wanted to talk a little bit about the pain, or like the recovery, what it feels like, because obviously I showed you some clips, but while I was recovering, I didn't really feel in the mood to do a lot of video myself. But a nose job is a weird surgery, because for a lot of people, it's not super painful, because they actually cut the nerve in your nose. And so everyone that I knew who had a nose job told me this, and I saw it in videos online, and I had a really hard time believing it because I thought, how can a surgery on your face not be extremely painful? Like, that doesn't make sense to me. But then once I was in that situation, I understood it's just a feeling of numbness. It's like you've gone to the dentist, they've put freezing needles all over your mouth, you can't feel a thing. It's that exact same feeling, but just for like the whole center of your face. So it's super strange, and I would say it's more like full face discomfort, but like it's extremely uncomfortable. And for the first week, you know, you saw the images of me, like your whole face is swollen. It's not just your nose that's swollen. The first week is horrible. Like, honestly, it was really, really uncomfortable. So although it wasn't painful and I did it without any pain meds, it was just the most uncomfortable I've ever felt in my life. It's hard to eat, it's hard to sleep, it's hard to drink even water. Like, you need people to help you with everything, to fill up my humidifier, to heat up my food, to help me walk upstairs. Like, it's really difficult. So even though it's not super painful, it's a lot of everything else, and it's just like you're foggy, you're achy, it's hard to sleep, like you have to sleep sitting up, like your back hurts, your butt hurts. Now, earlier in the video I referenced the ENT OHIP free version. If you're not from Canada, you probably have no idea what I'm talking about. But basically that's the government covered version of the surgery. So I was eligible for that. Before I saw 3 different plastic surgeons, I saw an ENT who was able to do that surgery. And the way he described it to me, I was like, I'm not doing that. They do not show you like a rendering of what your face is gonna look like. It's much more just for the intention of functionality, but I don't know, it's the center of your face. So I was kind of, so I felt like the plastic surgeon route was definitely the route for me. That being said, it's like saying significantly more expensive isn't even a comparison. Like the OHIP route technically I guess is like free, but the plastic surgeon route, you're looking at probably minimum 9 to 10 grand in Canada. And with all of my allergies and also my concern about the center of my face, I really felt like it was important to me. And it's for a reason. Like the length of the surgical procedure is significantly longer. I think my procedure, the actual procedure was at least 2 hours. And it's a different type and level of patient care. Like, I want to have a patient care provider who's on call 24 hours a day, and I called her a lot. In fact, she probably never wants to hear from me again, and I don't blame her, but she was always like super personable and kind. I want a surgeon who I can discuss all of the tiny little details that I'm concerned about, and I'm lucky that I could afford to do it. You'll get obviously multiple follow-up appointments with the surgeon. They're doing before and after photos, they're doing fillers if you need them. It happens in a private surgical center. The length of the procedure is significantly longer, and it's much more one-on-one, seeing digital renderings of your face before you get the surgery done, and talking about what your face is going to look like, and shaping your nose in a very realistic way. It's all of that. And I'm not going to say which doctor I went to, but I'll just say that he was in the beaches. And if you are in Toronto and doing that kind of research, or in Canada and doing that kind of research, then you probably know who I'm talking about, because he's awesome and everyone rates him like the best. So I think I'm going to call it here with this video. I know this was a long one. Thank you for watching all the way till the end if you did. And this was personal and honest for me in a way that I don't think I've ever been this vulnerable online. So thank you so much for watching it and for joining me on this vlog surgery journey. I know it was a lot, and maybe I'll do a 1-year check-in if you guys like this and you can see the difference then. I don't know. We can do more reflection, more self-reflection. But yeah, thanks so much for watching. Subscribe if you haven't already, and bye.